Manufacturing help is on the way for coronavirus vaccine maker Johnson & Johnson. The Biden administration announced Tuesday that pharmaceutical company Merck will help mass produce the recently approved single-dose vaccine. It comes after Johnson & Johnson announced it would only be able to deliver about 4 million doses this week. Meanwhile, Texas is now the largest state in the U.S. to roll back its mask mandate. Governor Greg Abbott lifted the state's restrictions Tuesday. The news comes as health experts warn more contagious variants could spark another possible surge. The total number of cases in the U.S. now stands at more than 28.7 million. More than 515,000 people have died. Janet Shamlian begins our coverage in Houston.
On the ground and into arms. But as the first Johnson & Johnson vaccines are delivered and administered, the Texas governor late today announced he's rolling back all COVID restrictions.
It is now time to open Texas 100%. Also, I am ending the statewide mask mandate.
And the Lone Star State is not alone.
This new order removes all of our county mask mandates and allows businesses to operate at full capacity.
Public health officials warn it's too much too soon.
If we lift the restrictions now, we're just asking for another wave. And remember, every time we get another wave, people die. Now is not the time to be lifting our restrictions. The finish line may be in view, but we're not there yet.
Yet it's happening across the country. Massachusetts is now allowing restaurants to open at full capacity, plus live performances. On Wednesday, San Francisco will allow indoor dining for the first time in months. And in Chicago, bars and restaurants can stay open until 1 a.m.
Because people are still adhering to the public health guidance. It makes all the difference in the world.
On the vaccine front, a major announcement today from the White House.
We also invoked the Defense Production Act. This is the type of collaboration between companies we saw in World War II.
Pharmaceutical giants and rivals now teaming up. Merck & Company, which failed to create its own vaccine, agreeing to mass-produce Johnson & Johnson's, substantially increasing doses.
We're now on track to have enough vaccine supply for every adult in America by the end of May.
The race to step up vaccinations coming as new COVID variant cases are on the rise.
It is really a call to wake us up. While we're getting fatigued, these variants will take any opportunity to succeed if we give it to them. And so we just cannot give them that opportunity.
Also tonight, President Biden is directing all states to prioritize teachers. He wants every educator to have had their first shot by the end of this month. Elaine?
Janet Shamlian, thank you. For more, let's bring in Dr. Dara Kass. She's an ER doctor and medical contributor for Yahoo News. Doctor, welcome. It's good to see you again. So, as we just saw, several states, aside from Texas, have begun lifting restrictions. Does this concern you?
So I want to be very clear that all restrictions lifted are not the same. Opening indoor dining at a limited capacity or maybe allowing bars or restaurants to stay open until a later time is not the same as lifting a statewide mask mandate from all restrictions so that an entire state with millions and millions of people no longer chooses to wear masks. So it's very disappointing to see states like Texas and Mississippi lift their mask mandates because that is absolutely the last step that should maybe be considered at the very end of this pandemic, but certainly not while we're still losing thousands of Americans every day.
Well, Doctor, we also saw that Merck is going to be helping its rival, Johnson & Johnson, with vaccine production. How significant is that?
So this is a really big deal. The Johnson & Johnson vaccine, because the single-dose vaccine actually doubles the time it allows us to inch towards herd immunity, towards vaccinating enough adult Americans to get us towards that promised land of everyone being vaccinated. And it's part of the reason that the president was able to say today that we should be able to have enough vaccine supply to vaccinate every adult American by the end of May. This is extraordinary. The goal was originally 100 million doses in 100 days. And now we're looking at probably tripling that rate so that the entire country can be vaccinated right at the end of May. That is just remarkable.
Well, the UK, it's interesting, is delaying second doses of the Pfizer and Moderna vaccines to get more people with at least the first dose. Now, Dr. Anthony Fauci says the U.S. should stick to its two-dose strategy. Remind us, doctor, why is the second dose important and what sort of protection does just one dose have?
So for the Moderna and the Pfizer vaccine, the mRNA vaccines, they were studied with a two-dose regimen. The first dose basically primes your immune system, and the second dose boosts it. Now, we're seeing a similar response in people who've already had coronavirus. So there is some conversation with people who've already had the coronavirus and recovered, whether or not just one dose of those mRNA vaccines will be enough. But there is no reason to depart from the strategy that we know works. If we can get to 95% effective protection with our mRNA vaccines, that's what we should be doing because we have the supply. So unlike other countries, there's no reason to depart from our strategy since we know we can have the vaccine available when we need it.
Well, the CDC is set to release guidance this week for people who are fully vaccinated, and it's expected to okay small gatherings with others who are also vaccinated, but masks and social distancing in public will still be encouraged. Doctor, why are these measures still important, even for those who are inoculated?
So it's a couple of things. When you're in a group of all vaccinated people, the risk is non-existent. It's low that the virus would transmit between individuals. So you can actually start to let your guard down a little bit. But that does require that everybody be vaccinated in that group. We ask people to wear a mask in public for a couple of reasons. One is in solidarity with those who are not vaccinated. It's not really fair for those who are vaccinated to just walk around maskless. You know, masks can be uncomfortable and not everybody wants to wear them. The other reason is that we just don't know about these new variants and other reasons that we may start seeing changes in protection from the vaccine. So there really is no reason to stop wearing masks in public. And I would just encourage people. I've been wearing a mask for a full year, even after having recovered from the coronavirus myself. And now I still wear one after having been vaccinated. It's just good public practice and it's excellent modeling for our children.
All right, really important points, Dr. Dara Kass. Thank you so much, doctor.
No worries.